I'm just so grateful that they decided to do the project, because they've changed my life and they've changed many others too.
PEACS is one that opened my eyes, that when I come and start meeting people, start talking to people, realize that I'm not the only one that's going through what I'm going through.
So where did PEACS come from? There was a lot of data telling us about the prevalence of chronic pain across the nation, and in particular in Lambeth. That huge prevalence was matched with this unmet need.
Lambeth-wide stats tell us about 20% of people suffer from chronic pain, but what was more pertinent was that there's a significant health inequality within that. So if you're a woman of black background, there's 40% prevalence of chronic pain. So that's a lot of people silently suffering with it, and probably not even being recognised as having chronic pain in consultations.
Chronic pain is a complex long-term health condition, which means that it's a condition that people typically live with. You might be able to manage the symptoms, but it's not a condition that's easily curable. And that means it impacts all aspects of a person's life, and that's something I've really come to understand listening to our service users and their experiences.
We realised very quickly that people struggling with chronic pain didn't really understand their condition, and so we put a lot of the initial emphasis on education for patients. But in doing so, we quickly realised that healthcare professionals also needed to shift their understanding of pain from a model of acute pain to chronic pain. The key step in how we developed PEACS was from the ground up, using this co-design process that helped us understand what is it people who would be using the service actually want, rather than the conventional model of developing a service, which is kind of from the top down.
In this project, we probably spoke to about 35, 40 people. 25 of them were really residents and people that experienced chronic pain. We spoke to loads of black residents because we wanted this pathway to really serve people from black and minority groups.
I think the success of the PEACS project was largely due to the co-design element, and this was reinforced by our evaluation, who stated that the co-design was an effective way to build relationships between the team and local stakeholders, improve our understanding, and again, identify gaps in current healthcare provision so that we could create a more suitable offer to meet the needs of the patient group. And without it, it wouldn't have been possible.
After going through the 7 sessions, they were asking somebody to represent those who live with chronic pain, and I felt that I needed to be a voice to let everyone know that we live with chronic pain and what it is to live with chronic pain.
Lambeth is a borough that has a really rich history, but it's also complex with specific regards to racial discrimination. And we can see the effects of that are long-lasting, and they play out today in terms of health outcomes and disparities that we continue to see. So we felt it was really important that in our design and our modelling that we addressed racial discrimination, both directly and indirectly.
The programme was designed particularly to address health inequalities in relation to chronic pain within the black community in Lambeth. And to this end, PEACS successfully managed to engage with patients from the black communities, with around 3/4 of core participants coming from black communities, particularly black women between about 45 and 64. That was the single largest group.
Across 2 years, the PEACS programme supported over 1,500 people. A large proportion of those people were from black communities, which is a huge win for us and a huge nod to the co-design element of the project.
Overall, the evaluation had very positive findings and demonstrated that a community-designed and community-based programme can be both clinically effective and also cost-effective in addressing chronic pain.
I'm a big champion for biopsychosocial approaches and focusing on the mind and the body. There's no physical health without mental health and vice versa, and so I think I'm hoping that through this project, we have encouraged clinicians, the healthcare system, to try something a little bit different, focus on the holistic needs of individuals, focus on the whole person, think about their lived experiences.
We have to make sure that what we deliver is representative of what it truly means to live with a condition. So it has to be representative and support people in the various aspects of their life.
I would say it was a real pleasure working on PEACS, both because it's really satisfying to see a programme that is creating these benefits for its members, and also to work with the team and the wider stakeholders who were clearly a very effective team, extremely committed and passionate about achieving the goals of the programme. And so, yeah, it was a real pleasure.
I have lived in South London my whole life. I am a black man, so I'm a product of a black woman. I was raised by black women. They all experience chronic pain. And so I remember pitching for this work and being really clear to say, number one, we're really capable. I'm a biologist, I'm a designer, like, we're really capable. But number two, it was, these are people I love and care for. And I think that emotional investment led to good stewardship from community for the part we played. And I'm happy to say we contributed meaningfully.
We as GPs know that in the long run, we have to change the way we work if we're going to better support our patients with complex conditions and long-term diseases. And for me, PEACS has shown us a way forward.
I learned a lot, and it's gonna be a joke, but I get a profession from it, because something that I didn't even know that I could do, and it burst out of peace, because coming here as well, it made me started doing this, and right now I could say it's my livelihood.
The PEACS team has been wonderful. They're just like our family. They're just like our family. They've been kind, they've been supportive, they've been compassionate. They have a listening ear. You don't feel rushed at all. Their heart is in it. This is their passion, is to help people living with chronic pain.